Chronic kidney disease is diagnosed through screening of people known to be at risk for kidney problems, such as those with high blood pressure or diabetes, and those with a blood relative with chronic kidney disease. And joining us now to tell us more about chronic kidney disease is Dr. Eduardo Alas. Thank you so much for joining us.
You're welcome.
Okay, so what is the cause of chronic kidney disease?
The cause in the United States often is high blood pressure, diabetes.
Okay.
And surprisingly, over-the-counter pain medications cause a lot of chronic kidney disease in this country.
Okay, so what are some of the symptoms?
Well, there aren't actual symptoms in early chronic kidney disease.
Okay.
It's often determined by a lab test that a primary care doctor can order.
Okay.
And help sort out whether you've got decreasing kidney function. At the later stages, people tend to have very high blood pressures, and their legs can swell up, and they can get a lot of food aversions.
Okay, so if you do start seeing symptoms, it might be a little bit farther along.
Yeah,
it might not be in the early stages.
Yes.
Okay, so how can you prevent it?
Well, the prevention of chronic kidney disease often is a healthy lifestyle.
Okay.
A low-salt diet tends to help quite a bit.
Okay.
A lower protein diet tends to also help prevent chronic kidney disease. And then, again, avoidance of these over-the-counter pain medications.
Okay, so what does the protein do that kind of affects it?
Well, what it does is it cuts the blood supply to some extent to the kidneys. It causes what we call a constriction to the kidneys, and then the kidney doesn't get enough oxygen. So.
Okay, very interesting. So there are treatments out there, correct?
There are treatments, and a lot of the treatments revolve around controlling blood pressure.
Okay.
And controlling the
Keep
protein.
hearing blood pressure.
Yeah, blood pressure is the silent killer, and
Okay.
kidneys are often the bystander of high blood pressures. And so we want to control blood pressure, and that also decreases the protein that comes out in the urine, and it's been shown to extend the life of the kidney.
Okay. Now, is this something that you can get from a family member?
In very few cases, it is there are inherited disorders that you can get from family members. But, quite honestly, most of the family members sit down to eat, and they eat the same thing. And so if you look at it that way, you can get it as a family.
Yeah, as a family. Yeah. And kind of a family battle. So if somebody wants to get checked for this, they think, okay, maybe, or they have a history, they have high blood pressure, diabetes, what should they do? What should be their first step?
Well, to go to your primary care doctor and get a serum creatinine or a kidney measure. And if it's below 60, then really you should be seeing a kidney doctor at least on a yearly basis for monitoring and treatment.
Okay. And then, so if they find out that they do have chronic kidney disease, what is their next step? How do they go forth?
Well, we at Sandoval Regional Medical Center, we have a chronic kidney disease clinic.
Oh, okay.
It's pretty easy to get into. You pick up the phone, and we can schedule right in.
Great.
And we do initial assessments and then treatment thereafter.
Great.
So, yeah.
Okay. What is your website?
It is srmc.unm.edu.
Okay, cool. Don't worry, we'll post that. We'll post that on our blog or on our website. So if you guys want any more information on that, just head over to casa.com. We'll have all the information there. For now, we're going to send things over to Chad.